You take roughly 20,000 breaths a day, and every single one depends on lung tissue thinner than a sheet of paper. In pulmonary fibrosis, that tissue is slowly replaced by scar. Stiff, thick scar that makes it harder for oxygen to reach your blood. For many people, the cause is never even found. But understanding what is happening inside your lungs changes how you face this diagnosis. Pulmonary fibrosis can sound intimidating, but breaking the words down makes them easier to understand. Pulmonary simply means related to the lungs, the organs that fill with air every time you breathe in. Fibrosis refers to the formation of scar tissue. So, pulmonary fibrosis is a condition where the lungs develop scarring. This scarring replaces the soft, flexible parts of the lung with tissue that is thicker and stiffer than normal. Over time, these changes make it harder for the lungs to expand and for oxygen to pass into the blood the way it should. Sometimes doctors can find a reason for the scarring, such as past lung infections, certain medications, or long-term exposure to dust or chemicals. But in many people, no cause is found. When this happens, it is called idiopathic pulmonary fibrosis. Idiopathic means the cause is unknown. Understanding what the name means is the first step in understanding the condition itself. Pulmonary fibrosis is not just a vague breathing problem. It is a real change happening in the lung tissue. And knowing this helps people begin to make sense of their diagnosis. Inside healthy lungs, the tissue is soft and springy, stretching easily with every breath. Pulmonary fibrosis begins when the lungs face repeated tiny injuries, or when the healing process doesn't work as it should. Instead of repairing the damage and returning the tissue to normal, the body sends out special cells called fibroblasts. These cells start laying down extra layers of material, mainly collagen, which is the same substance found in scars on the skin. Over time, this buildup of scar tissue thickens the walls of the tiny air sacs where oxygen usually passes into the bloodstream. The lung tissue loses its natural flexibility and becomes stiff, a bit like a sponge that is dried out and cannot soak up water or squeeze as easily. This stiffness makes it harder for the lungs to expand fully with each breath. People may notice that breathing feels more difficult, especially during activities that used to be easy. As the lung walls get thicker, oxygen has a tougher time moving from the air inside the lungs into the blood. Even though someone might still be able to breathe in and out, less oxygen makes it into the body with each breath. This is why simple tasks can start to feel tiring, and why people with pulmonary fibrosis often describe a growing sense of breathlessness. The scarring does not happen all at once. It builds up slowly, quietly changing how the lungs work long before symptoms become obvious. Understanding these changes helps explain why the effects of pulmonary fibrosis can gradually become more noticeable over time. Shortness of breath is often the first sign people notice. At first, it might only show up when walking upstairs, hurrying to catch a bus, or carrying groceries. Everyday activities that once felt easy can start to feel like hard work. Many people also develop a dry cough that lingers and doesn't seem to go away. This cough usually doesn't bring up any mucus, and it can be especially frustrating because it's often there for months before anyone connects it to a lung problem. Fatigue is another common experience. People may find they have less energy for chores, hobbies, or time with friends. It's not just about getting tired easily. Sometimes, even simple tasks leave a person feeling worn out. Some notice chest discomfort, a sense of tightness, or even mild pain, though this isn't always present. In a few cases, unexplained weight loss can occur as the disease progresses. For some, the tips of the fingers or toes become rounded and broader than usual, a change called clubbing. This happens over time and is linked to low oxygen levels in the blood. When a clinician listens with a stethoscope, they may hear a soft crackling sound, a bit like Velcro being pulled apart. This is a clue that scarring is present in the lungs. Noticing these patterns is important. Writing down when symptoms appear and how they change can help describe them clearly during a clinic visit. The more details you can share, the easier it is for your healthcare team to understand what's happening and plan the next steps together. Diagnosis of pulmonary fibrosis is a careful process that brings together information from several steps, each one designed to answer a specific question about what is happening in the lungs. It starts with a detailed conversation and examination. The doctor will ask about symptoms, like breathlessness or cough, plus any past illnesses, family history, or possible exposures to things like dust, mold, or certain medications. Listening to the lungs with a stethoscope, they may hear a soft crackling sound, which can be a clue that scarring is present. Next, lung function tests help show how well the lungs are working. Spirometry measures how much air a person can blow out and how quickly. Another test, called the diffusing capacity, checks how well oxygen moves from the lungs into the blood. In pulmonary fibrosis, these tests often show that the lungs hold less air than expected and that oxygen transfer is reduced, even if the person can still breathe in and out. To see how the body handles activity, oxygen levels are checked both at rest and while walking, often with a simple finger sensor. Some people may notice their oxygen drops when they move around, even if it is normal when sitting still. This helps doctors understand how the disease affects daily life and whether extra oxygen might be needed later on. Imaging is a key step. High-resolution CT scans create detailed pictures of the lungs. Doctors look for patterns that suggest scarring, such as the honeycomb appearance seen in idiopathic pulmonary fibrosis. If this pattern is clear, a tissue sample is usually not needed. Blood tests are also done to rule out other causes, such as autoimmune diseases, which can be treated differently. Sometimes, more information is needed. In selected cases, a doctor may recommend bronchoscopy, using a thin tube to look into the lungs, or even a small surgical biopsy to collect lung tissue. These steps are only taken if the diagnosis is uncertain after other tests. Throughout this process, a team of specialists, including pulmonologists, radiologists, and sometimes pathologists, work together to review the findings and reach a diagnosis. This approach helps ensure that all the pieces fit together, giving the clearest possible answer and guiding the best next steps for care. Treatment for pulmonary fibrosis always begins by looking for a cause that can be treated directly. If doctors can pinpoint a trigger, such as a medication, an autoimmune condition, or an environmental exposure, they will focus on removing or addressing it. For many people, though, the scarring has no clear cause. In these cases, especially with idiopathic pulmonary fibrosis, the main goal is to slow the disease and make daily life more manageable. Pulmonary rehabilitation is another important part of care. This is a structured program led by specialists to help people build stamina, learn breathing techniques, and improve quality of life. Symptom management may include medicines for cough or anxiety, regular checkups to monitor lung health, and vaccinations to prevent infections. Stopping smoking and avoiding dust or fumes are also essential. For some with advanced disease, lung transplant assessment may be considered. Every care plan is tailored, aiming to support both health and daily living. Living with pulmonary fibrosis means finding new rhythms and ways to manage everyday life. Routines may need to change. Some people adjust work hours or ask for help with chores, while others find that relationships take on new meaning as partners, family, and friends become part of the care team. Keeping a symptom diary can make a real difference. By jotting down changes in breathlessness, cough, or energy levels each day, it becomes easier to notice patterns and share clear details with doctors during appointments. Bringing written questions to clinic visits helps make sure nothing important is forgotten. Many find comfort and practical advice by reaching out to support groups or connecting with others who understand the ups and downs of living with this condition. It is also common to feel fear, sadness, or frustration. These feelings are valid. Talking with a counselor or mental health professional can help lighten the emotional load. No one has to face pulmonary fibrosis alone. Staying informed, asking for help, and building a support network can make each day feel more manageable and hopeful. Every day, thousands receive a pulmonary fibrosis diagnosis, yet with early recognition and the right care, life can still hold hope and connection. Support, information, and advocacy matter now more than ever. This video is for educational purposes only and does not replace medical advice from your healthcare team. Pulmonary fibrosis is one of the conditions we support at Mama Health, a place where people living with chronic conditions can get clear, personalized support and feel less alone in their health journey.